Well, good evening again. This is Dr. Bill Wyatt in beautiful Glen Rose, Texas, except it's nighttime now. But I want to talk to you about some things that help you in orthodontics. I call it aids in doing orthodontics. There's a lot of little tricks that you can do that help you a great deal in orthodontics. And so we'll try to just talk about some. I want you to feel like we're just sitting here talking to you, even though you may be in some country as far away as Australia or something like that. My grandson called me from Australia last night and had his picture on the phone, and I thought he was in town. So these are marvelous things that we have today to help us in learning things, and I hope you're taking advantage of this. And so I'm going to just show you some little tricks of the trade or things. It's not all that complicated or anything, but there are things you can do that just make the work go easier and do better orthodontics. That's what I really want to do. I want to have to go back over here and mark these little pins, I think, and to see if we get that done. Now, for several years, the only flexible wire that I used was this kind of twisted wire. I think it's got about 3 strands or 4 strands in there, and it's twisted together, and it's about 18 thousandths, in other words, in size. And this is just a whole bundle of these things. And later on, we've came to using about an 016 niti wire, which was very hard to get a bend to stay in. You had to bend it way past where you want. Now this wire works good as the flexible wire that you have inside your braces. And we're going to hook these up, and you don't have to have a wax pattern or anything to bend the arch wire out of this. And that's what I want to show you here. Now here's this multiple strand twisted wire, and how it's constructed and everything. And we're going to make an arch wire that goes out and comes up, comes over, and comes in again. And the way we do this, we bend one of these sides out like this, and now we insert that in the mouth, and maybe you have to cut this off or whatever. Don't want to stick it out poking the person. And you leave the little U in there kind of open like that. Now then you're going to tighten this thing up, and your little U will be kind of like this. And it's pushing forward when you put it in like that. And you go around to the other side, and then have the patient hold it in the brackets like this, and go around and mark the other side of the mouth. I'll show a picture of it here just a minute, and they would hold it for you. You mark it and take it out and bend that in there. And now when you put this in the mouth, this goes against the molar tube right here, and against it over on this side, and the arch wire, the teeth might be here, and the arch wire would be standing out in front of the teeth. So you tie the arch wire back, and as you do, it pushes this U back, and so you just have a reduction in that. But then this is constantly being expanded out. As you see, this wire expands the whole arch, lines them up. It does about 8 or 10 things you can do with this little flexible wire. and we just put it on everything. It levels the teeth, like from one tooth would be up higher than the other tooth, and another one would be down here. Well, it lines them all up, levels them out. It rotates every tooth in the arch. If you've got a bicuspid or something in here, and you've got another one that's sitting like this, and when you push this wire tight, it will tend to rotate the tooth that's out of line. So that's another thing that it does, and it expands the whole arch. And so if you expand the arch, you're actually adding positive torque. You're tilting the teeth in a forward direction. I was working in the garden out there this evening. I see my fingernails are quite dirty here, but it expands, and it expands. That adds positive torque to the arch wire itself. So let's get in and look at some other things that this little flexible wire does now. Here is a plier that we use to bend this little wire. It's no problem bending it at all, but these are little sharp planes, and they'll cut the wire off in here. These are little troughs that it fits in, and if you're making loops or small loops, you can make them around that part. However, I like to use a Tweed loop forming plier to do that. It's better than this one actually to bend those small loops. So here we take this wire and we grab it right here, and we bend a 90-degree bend in it, and then we're going to come in and catch it, bend it back up here, except I want to have some space in it, and now bend it back and force this out the other side. And then this arch wire, of course, is coming over here, and you'll do the same thing on the other side of the mouth also. Now let's get another one. Now we catch this loop out here. In other words, you go bend it down like this and catch it with a plier here, and now bend it back up this way. Then we'll catch it here and bend it back in this direction, see, leaving that loop kind of open in there, because we're going to put some pressure on this, and this will be done like that when you get it tied in. If you need some space in the arch, and as we level a deep bite, it opens the space up too. There's just a lot of little tricks to use to give you space enough to operate the deal. Now here we catch the wire up there, and we bend it around the round portion of that wire, and now we've got this wire. Now say this is somebody's mouth, and we would just take that and put it in the brackets of the molar. We have the second and first molar banded, and we have these lingual buttons on them. So if you want to do this stuff like we're doing it, you're welcome to. I use a 018 bracket slot. In other words, you go down like this, come across this way, come down, and this is 18 thousandths in this vertical dimension. The horizontal dimension is 25 thousandths. That's not a very good 5, but it's a kind of a rectangular wire. It's something like that, and you're going to have to slip it down. Now, I usually use a 1725, which gives me 1,000th clearance in going into that like that. All right. I wish each of you that's watching this, or when you watch it, it would be real nice to see you and answer your questions right from the floor, but there's no earthly way that we can do that. So this is marvelous, this what we do on YouTube and Facebook and several other things. All right, we put this wire in there, and this is not squeezed up yet. And now we come in and have the patient put the wire in there, and now we take it and put it in the other side, going back here. And this side may be kind of constricted in other words, you may constrict the arch down. As we tie these in, putting these in the bracket slot, this will get even smaller, you see. And so it's pushing in a forward direction. It's leveling the teeth. It's rotating teeth that are in there. It's actually leveling everything from tooth to tooth as you go along with it. But a deep bite, it's not going to do it. We have to put the intruding arch wire in there to do that. You can make these just real quick and snap them in. You can tie them back in however you want to. And they'll be expanding an arch, which is targeted and leveling from tooth to tooth, and also kind of leveling out the curvous feet, part of the way, not totally. And you can put little things on them as far as you'll have class 2 corrections, things like that on there. All right, now there we've bent one of them, and we've got the other one bent, and we're going to insert these in. Now you see they're sticking in there, and this wire is so flexible it'll go back like that into the second molar. And we've got this reduced slightly, and this one looks like it's reduced a lot over here. Now as I come in and bring the front of this up against these teeth, it's going to reduce this tremendously. That'll be almost touching back in the back. So you'll have a lot of expansion going on in the arch. Now in this particular one, we don't need it, but a lot of times you're dealing with something that's crowded down in here, and you want this expansion. Where you don't need it, you can actually make these loops smaller to start with, and they won't actually expand the arch that much. So here we let that out. We tie the two front deals, and you always have the center of this arch wire marked, so you'll know you've got it in the center. Now I'm going to tighten each of these and put them in place, and it's going to close that loop, really close it quite a bit, so it'll be expanding this arch quite a bit. Now there we have expanded, and we put everyone but there, and you see this loop has gone from something like this into something like maybe this, and it's pushing on this. It's pushing forward on these teeth, and it's pushing backward on these right here. And then you can tie these back and line them up and get them everything in good shape with just this little flexible wire in there. You can let them go home. Now this lining these molars up like this, and you see this bracket goes out here, so you're going to have to make a bend if you put a rigid wire in there, and you'll have to take this in and out, so you need an omega in this to tie the arch wire back, so you can tie it back each time you go back and forth in, taking it in and out like that. Now here again it's lined up and everything. It's in the bracket on all the teeth. Now I like to take something and apply that's close, real close here, and bend this in on both ends. That thing, little thing right there, irritates the dickens out of your lip right there. So we try to bend it in where it doesn't hang the tissue at all. Now, this looking close in on this is a molar band, see, and we have to make a bend in this wire to go into the second, well, that's the bicuspid, but we have to make enough to go into the second molar back here. So we convert this 6-year molar. You can peel the top off of these, and now you've got a bracket, so you've got to tie this wire in there, and that's what we're doing here. Twist it down. You're going to cut this and move it down like it, and won't aggravate the person, and it'll hold in there. And as you finish this up, this loop right here will go down and come up something like that. In other words, you got about this much expansion of pressure on the front teeth to go forward, and also these teeth to go backward. And then once we get what we want, we come in here and tie this thing back, and it'll stop the expansion where you want it to be. So now there it is. There's put in there, and put it in all the brackets up. That's on this side, you see. And to tie this thing back up here, it took this loop and did it like that. Now this is pushing forward with a certain amount of force, and it's pushing back here with exactly the same force. And, and a lot of times if it starts to open a gap here, we may tie this, and then the expansion will take place further up in the arch. Or you put a spring further up in the arch for that. Now there we are. Here, this tooth, we needed room, so we ran a coil spring in there. Now we've advanced and got about an 016 round wire. Maybe this is a wire, and we're opening space for these two laterals right here. We're pushing that. This spring is pushing this wire back. It's shoving these teeth back. And of course, on this type thing here, we would band both these teeth back here so they would move back with that. But this is just some ABC orthodontics that we're just going to pass out. There may be places in the world where this is not known. As we make room here, we'll put a bracket on this, pull it out, or bend this in, tie it to it, and it'll bring these teeth out in line and line them up like that. That little flexible wire just does a marvelous job for us. Now there it is, going like that. Now here we're gonna bend one of these little springs, and I'll show you what the spring does. I'm gonna have to get a little water on my vocal cords. Sounds like, anyway, we're going to take a piece of rectangular wire. Now this is a torquing turret. You can buy your arch wires made already, but we usually bought ours in just straight sticks and cut them in two, and then we would make the arch form like that. There's 0 degrees here. The next slot is 7 degrees, 10 degrees, 13, and 16 is the most you can put in there. Now you put an 018 arch, and these are 018 slots in that, but it's slightly lighter than 018. Now, if you want to torque your own arch wires, that's what we get. Now you've got a deal coming in like this, and you'll have a deal coming down, and that may be 16 degrees, and the next one over here might not go down quite as far and go up, and this one might be what I think is 14 degrees, and then the next one might be 10 degrees, and it gets down to the last one here is 0 degrees, this one here. So we can hold this with your fingers. It's kind of hard to me to show you that on here. I'm going to put a cough drop in there. Let me go ahead and close this out. Now this is close up. Now you got to force this wire down into this deal, and you can't torque it the second time. As you bend this arch around, it's going to come around like this, and it'll put 0 degrees torque in it. In other words, it'll be like this all the way. Now this one up here is 7 degrees, and it'll go around, but it'll have a slight torque in it, something like that. And that's what we use a lot of times to make the various degrees. And a lot of times you just use the torque on between the two centrals. Between the cuspids, and your laterals and centrals all have torque, but the cuspid has no torque. It'll come in and just be straight up and down. So you don't want to have it sloped like that. It's the outside part of the cuspid is like that. Now that's there's a difference in a male cuspid and a female cuspid. The female cuspids will not be tilted out as much. Now male cuspid may come out, have an angle like that, have torque in it, and the females normally doesn't have any torque in the cuspid. So that's just another little thing you need to kind of know. All right, there we spin that out, and we take our fingers and hold that down in that place. Now this is the place where you buy this wax, this dental wax, and it's pure beeswax. It's just dead salt, and it makes wonderful wonderful prints that you can bend any kind of loop you want to from a print in this wax, and it'll fit back in the mouth. Now that is a big help in doing orthodontics. Here the wax comes in a rectangle. This is half of that rectangle right here. I took a lot of bees to make this, so take care of it. Otherwise, the other part would be up here. We break it off or cut it off or whatever you want to, and you use 1/2 for each wax pattern that you take. Now I'm going to take that and go to the mouth, except I'm going to have a typodont underneath here, and so we put it on the typodont. Now it's harder to take this on typodonts because the wax tends to stick to it a little bit. So if you kind of moisten this so it's not going to stick to it, and press it down. Now you see the molar brackets in here. This is the second bi, first bi, cuspid, lateral, centrals, laterals, and going on back on the other side. We press it down, then take it off without flattening it at all. Just keep that. And then you mark the center of it, and you can bend your arch wire. You can put loops in there, you can put your omegas, whatever you want, and use up the back end of the arch wire, and then you cut what you have left over, just take it off, throw it away. All right, that's the wax pattern. Now there it is, and I come in, I make my wax pattern, I mark where my molar deal is, and I mark the center too, and then you put your wire in there, and there, that's a little planer. You can see those bracket slots, and you need to be right behind the bracket outside base with this, and it will surprise you how accurate. You can put the loop or something right next to this bracket if you need to. Now we'll add some torque to this, or we'll bend this wire in, as we finish it. We'll do that. Now this marked in front of the cuspids. I didn't mark the center place right here, but marked in front of the first bite, in front of the 6-year motors, and go back that way. Now here we're going to bend a loop. I've shown this on another video just recently. So this is a Tweed loop forming plier, and it's going to bend a circle in this deal. We're going to go around this second deal of that, come in and go either behind this or in front of it, and come back out, and you'll come over to here, and then you bend it on the side, and you put this one out like that, and you'll have a wire going this way, and then you can activate one of these down like that. If you are doing something like closing space, or you're leveling an arch out, you'll do that. Now that's not difficult to do. There, we'll squeeze that down with a loop. This is a Tweed loop forming plier. It is the best one I've ever found to do that. And we're going to go all the way around, come back up on the other side, and then I roll this around where you got this little soft part, sew it up here, bend this out, and now I'm going like that with this. But this wire is in one width of the wire, and if you want it to be this to be in the same exact plane, you have to change this, rotate this loop just a little bit, bringing it out to yourself. So then this will line up straight going up through there. All right, there, I think I've crooked that a little bit. That's the loop. Now there, it's got a little bit of this in it, but this is going here, and it's just a little bit over on that. You may want it that way. If you want this part to come off exactly like that one, then you have to put a little more angle in that loop that way. Now that little loop has a lot of uses. I mean, it's many. Now here we're apparently planning to do an intruding arch at it, and we bent these little deals going up here. We came up here on this one and activated it down, and we sharpened this a little bit here, and here this is out of focus, but we're going down, and now we've got an arch wire coming around this way like that, and the arch wire, the molar teeth back here like this. So this wire is being bent down, and it may be catching these teeth, and one way it's going to put a lot of force as you pull it up here and hook it to this. These teeth can be way out of place, and this, you pull it up and hook it to the front teeth out here, and it pushes this down, and this will tend to go up. But then they're chewing on these teeth, and they're not on this. So you'll intrude the upper and lower teeth with something like that, if you'll just learn how to use that. Now here we've got the little flexible wire in there, you see, and I take this with a plier and insert it into this shaft right here and come around the front. The wires have activated it. It's down, it's here, and we're going to raise it up and hook it. If these teeth were going up like this, you see, we'll raise this up and hook it to the ones that are up here, and it will actually, I've never seen anybody's bite that we couldn't level out. I mean, this is the most efficient way to flatten a bite. You'll see it on lots of cases. As you go in there, you'll see this will have some kind of a curve to it right there. But it'll be bringing these teeth down. Now, your teeth will tend to come down. Now, like a central might be sitting like that, and it might have a root down the bone this way, and you're out here and you're pushing down on it. This is going to tend to move forward too. So you don't want it to move forward. So you can tie this wire back here where this cannot stretch out anymore. So now the tooth will tend to go straight down, or else you have to put some reverse root torque and intrude those teeth like you may want. Now there it looks at it from the front. We're going to raise this up and just attach it to those teeth in there. And we do it with, now there's a trick to everything, seems like. I'm going to twist this wire onto this rectangular wire, and it'll kind of, you have one wire here and another wire out, something like that, and you've got this going around them, and you twist it down over here. Then you come in and push on this, and this thing will slide around that, and then it'll spring back, and the twisted part of this wire will be poking back then instead of out like this. And you just have to do that on about 3 or 4 teeth in the front part of the mouth. All right, there we have it tied on 3 deals. We come in and clip it off. Now we catch that, and as we poke it, you see that one climbs up on top of the other one, and then this thing will go boom, and it'll just go back, in this twisted part of the wire here will be going back in this direction, and it'll stay there. I mean, they're brushing. I won't cause that wire to come out where they aggravate them. So that's another good point of that. Now, we tie back all of those, and then we go ahead, and this is just the thing finished up. And now that's the end. I think we're about at the end of this deal. The little flexible wire is going right through here, and here's our intruding arch right here. It has that bend in it, but we may take that out when we get it like we want it, and this will be straight across. Now there we are with the intruding arch working on these, pushing this down. This is coming down here, and this is coming up here, and these teeth move together a little bit, but the occlusion keeps them from doing much of anything. And you can take these teeth, they can be down here, and these teeth will be up here, and it will intrude those teeth and just embed them. Then the bone moves with the teeth. And I don't know how long it takes for that to catch on. Now there the arch leveling is. This is the most efficient, cleanest way to level an arch that I know of. And it'll do it on this darn near anybody. Now, we didn't want this to expand anymore, so we put a tie back wire in here and push on that and twist it down, and this can't expand anymore. So that's one way of dealing with that. Now there's the finished part of it. And that's it. I hope that you got something out of this. This is good orthodontics, and you can do most anything you want to this. So don't let somebody tell you that the bone is hardened and this is that and that. You can't separate the sutures. Some people, I had one guy that was 40, or just about 40. I couldn't pull them apart, but we were able to expand it. We just stretched the palate. I mean, it went ahead and did that. But we can open sutures on people in their 30s and some people in their early 40s and widen this out where they are mouth breathers and their maxilla didn't get to develop properly. So I'm going to hush down. We'll cover a lot of this other stuff later on. Thank you for watching, and join our group here and subscribe to our channel. So I will see you later, and thanks again for watching.